Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello friends, welcome to another episode of Healthy Desert, Healthy You. Today my guest is Dr. Jill Hingston, who is a health psychologist and licensed marriage and family therapist, serving as Chief Behavioral Health Officer at the LGBTQ Community Center of the Desert. Dr. Hingston is passionate about providing affirming, trauma-informed care to LGBTQ plus individuals and their families, and has led the center's behavioral health clinic for more than 12 years. I am particularly excited that Dr. Hingston is here because she is also going to be participating in the third annual Healthy Desert, Healthy Youth Summit on September 10, 2026. Actually participating on a panel that's titled Early Intervention Matters, Advancing Youth Mental Health Through Prevention and Community-Based Supports. Welcome.
Thank you, Will.
I'm so excited you're here.
Same. And just to correct one thing, I've worked in the clinic for 12 years. I've led the department since 2019.
Okay.
So 7 years.
That's still significant.
I had to get my feet warm first.
Achievement, absolutely.
Yeah.
So I'm wondering, since you've been there heading up the department since 2019, serving the LGBTQ plus community, how has the clientele changed during that time?
So when I first started in early, I believe it was 2013, we mostly saw, because we had started as a senior center, we saw older folks, typically 60 years plus. And through the years, we've intentionally wanted to bring in more people and make everybody feel welcome. Now we're seeing much more, while we still see the older demographic, the majority of our clients, we have many more 20-year-olds, 30s, 40s, 50s. We see a lot of couples. We do see kids also. I think the youngest one in our clinic recently was 8 years old.
Oh, wow. So, that's quite a diverse range of ages. So I imagine the issues change as well. So what are the more frequent issues that you're seeing?
For younger folks, typically it tends to be gender identity, gender expansiveness, and that comes along a lot with the parental use of our clinic too, because families just want to be able to be on the same page and parents want to know they're supporting their kids. We've seen a big influx of women also, lesbians and bisexual women coming to the clinic. I think for a very long time, nobody knew we existed. And so now that the word is getting out, we always have a wait list. Thankfully, it's not typically that long. People don't have to wait too long. But we are always constantly answering that phone.
Oh, wow. So what is the size of your team at the clinic?
So we're a clinical training site, and what we do is we take students and newer therapists who are working on their hours for licensure and teach them how to work in our community in an affirmative and competent way. Because as we all know, historically, our community has been very hurt by psychologists and medical providers. And so what we are able to do, I think the last time I counted, it was 55. We're able to put new therapists, once they get licensed, into the world at large who know that what they're doing with us.
Right.
Yeah.
Oh, wow. You said something that really, it stayed with me. You talked about how parents are coming to the clinic because they want to know how to support their children who are exploring issues of gender expansiveness, primarily. That's very different from, I guess, when I was growing up, when a lot of parents wanted to correct, or they would go see someone to correct the child's, whatever
and
they
even
were going through.
My own career, I had a private practice I started seeing trans kids in 2008. And at that time, most of the calls I would get would be, my child is saying this, please tell me this isn't true. I don't want it to be true. Now the calls we get are, how can I support my child? I want to be able to not hurt them, not offend them. I want to support them and care for them in the best way possible. So
it's progress.
Yeah.
Okay, that's awesome. For the people in their 30s and 40s who come to the clinic seeking care, what are those issues very different from younger people and seniors, or are they the same?
I think in that middle age range, it tends to be more of stress of the world, finances, relationships. Like I said, we see a lot of couples, and so a lot of that age range is managing relationships, learning how to adult.
Right.
And the political climate adds a ton of stress to people.
Absolutely. When thinking about your coming to chat with me today, I thought about the political climate and especially the effect on our transgender community, many of whom, or all of whom, have been weaponized for political gain. So I can imagine what the stressors, what the impact and the effect.
Right.
So what are people who are transgender, a part of that community, what are they telling you when they come to see you?
Well, and this is another, I've been running the Trans Tuesdays group for probably 11 years now. It used to be monthly, then it was weekly, now it's every other week. Right now what is happening is folks are really confused. Do I get my passport? Do I change my name? Do I still use an X gender marker? Should I not? All of those things, and gender-affirming care has become much more difficult to access. And so it's sharing the support, it's sharing the knowledge, and just helping people make the best decisions for them.
Right. What are the biggest obstacles to seeking mental health care? Is it stigma? Is it just a fear of there's going to be some kind of repercussions? I
think it's stigma and it's money.
And money.
So that's why access is the most important thing for our clinic. We've always operated on a sliding scale. We only recently started taking insurance, which then helps us, but the client pays no more. And the stigma part is real. We recently hired, in the last year, a couple of Spanish-speaking therapists. And we have a site in Coachella, and we're trying to get the word out that we are there with Spanish-speaking therapists for the queer folks out in the East Valley. But it's been difficult.
Right.
And so stigma is definitely an issue still, even after COVID and people talking about mental health. We recently had one of our donors actually contact me and say, hey, I don't want anybody to see me walking into the clinic. Is there a way I cannot be seen? And it's hard to convince people that actually we all think it's a great idea that everybody have a therapist right now, because the world is really hard,
right.
But there's still such shame, like there's something wrong with me if I need to talk to somebody, and that's just not at all where we're coming from.
Right, and it is different for different cultures as well, because I know for the African American community, and it has improved, I'll put that out there, but for a very long time it was, we don't do that.
Yes.
We talk about things among ourselves.
Exactly.
We don't seek help from professionals, but that has changed.
Yeah.
So that's good news.
It is changing slowly but surely.
Right.
Yeah. And one of the things that we do also, I think that is different, that attracts people, is that because we are at the LGBTQ Community Center of the Desert, our target audience, obviously, are queer folks. And we do therapy through an affirmative lens and with a minority stress model in the background, because if you think about how we all had to grow up, the world was not affirming for us, not accepting, actually didn't want us, still don't in a lot of places. And so it's about helping people understand well, I have these responses to things, or I feel emotional about these things, or I react in a certain way because, like I use this example about myself. Growing up, all my siblings could get married, but I knew I would never get married. And so what does that do to me? I feel less than, I feel not equal to, all of those things that it brings.
Right.
And so what does that do if I have to always know who's behind me when I hold my partner's hand? And so the psychology of that and how queer people grow up, we have more drug and alcohol use in our community, and that's part of the reason.
Right.
Because that's, we self-medicate to push down those emotions.
So is behavioral health or this substance abuse part of that also part of the clinic and the services and programs you offer, or no?
We don't do a whole lot of that.
Okay.
We will help people stay sober,
Okay.
and actually work on the issues for why they drink and use drugs. But because there's so many programs in the area and rehabs and recovery groups, that's not what our main focus is. But we do have a smart recovery group in the clinic, and the center holds a ton of peer-led 12-step groups.
Oh, wow. How many people are you seeing per week? Because you do serve residents from across the Coachella Valley, and you mentioned the site in Coachella. How many people would you say?
We see, so in the month of June, the clinic saw 140. And then when you add the participants in our 10 support groups, that goes up to over 200.
That is a lot of people.
Yeah.
Wow.
And we see people virtually. Licensure laws are that we can see anybody as long as they're in the state of California. So we do have clients in San Jose, San Francisco, San Diego.
Right. So I mentioned at the top of the episode that you're going to be part of the summit.
Yes.
September 10th, and I'm very excited about that. And the panel that you're going to participate on mentions early prevention. So I was just wondering, for people who are listening and watching this podcast, what are there signs, things people should be aware of, what you're feeling in order to seek help?
Yeah, I think if what you're experiencing and any emotions you might be struggling with, especially if it's impacting other parts of your life, like, it's so helpful sometimes just to say things out loud and even understand, why am I like this? Why am I doing this right now? Why is this person impacting me in this way? Because again, the world is so hard right now to relieve any of that stress and just have that space. Because who listens to us for 50 minutes? Who does? Uninterrupted, without judgment? Nobody. Not our partners, nobody.
Right.
And so...
Your pet, maybe.
Yes, but she also can walk away really easily. But that's our work, is to be there and be present with people, and help them and witness their struggles and help them move through that.
Right. Just the fact that you are saying the world is hard right now, I don't have a lot of people even saying that.
Yeah.
I mean, they're grappling with it, struggling with it, but nobody's that I know is really saying it.
It's a defense mechanism, denial.
Right.
If you don't say it, it's not true. Yeah.
But it's still very much true.
Yeah, it's true.
Yeah, absolutely. So I know also that as part of the summit and part of what the center does, it's very much about community-oriented. The panel discussion talks about community, based support. How do you integrate that into what you do at the clinic?
So one of the, I think a really effective form of therapy is group therapy. We've had a bereavement going for probably 9 or 10 years. And that is especially one group where people make connections that they last, they continue. We had a bereavement group maybe 6 or 7 years ago. The folks are still meeting monthly for lunch.
Wow.
Because if you can imagine, in that space, people are very vulnerable. They've shared this horrible experience of losing somebody they love. And so just the connection that is made in those rooms is very powerful and can last a really long time. And then you feel part of a community. I mean, we get a lot of people who, I lost my partner of 30 years and we really don't have friends because I relied on my partner for everything. And so then they're able to find a space where they share this with somebody else or with a group of people.
So that example about the partner who lost their partner reminds me that isolation is a huge issue for us, especially our older residents in the LGBTQ plus community. So do you see that a lot at the clinic?
All the time. All the time. I moved here to Palm Springs. I thought it was going to be different. And they isolate. And it's fascinating because I think, especially on top of COVID, we understand that older people isolate because, much of our community, we don't have children. We may or may not have partners and friends. We move here to this retirement town, and it isn't what we thought. But also other demographics are very isolated. If you think about younger people on their phones, they think they're connected on some level or feel that way, but they really aren't, and it is frightening.
Right.
Just the amount of loneliness and isolation. And we do ask that question about loneliness and isolation on intake, and then when people are done with their therapy, we ask it again, and inevitably it's gotten better.
Wow.
Yeah, because they feel connected. If not to just the clinic, we have the whole other part of the center that we refer people to.
Right. So I read this piece recently in the New York Times, an opinion piece, so with a grain of salt, well, basically saying that all of us in general are much more aware of behavioral health and mental health issues in ourselves, and that's basically a good thing, of course. But there's also the argument that people are no longer allow themselves to have a normal level of anxiety. They automatically think this is a very serious issue that they have to deal with. What do you think of that?
I think don't diagnose yourself off of TikTok. We seriously, we see this a lot.
Part of that.
Yes. I think depression and anxiety, it goes with life. Every single person experiences that. And actually anxiety can be really beneficial, as can depression, to motivate us to do something different. But I think that the toleration of emotions is, people are afraid of that. Like, I don't want to feel this. I don't want to feel this. And we always say, you got to feel it to heal it. Like, you have to move through that. You cannot go around issues in your life. You can't go around your trauma. You have to go through it.
You have to go through it. Got to feel it to heal it?
Yes.
I like that. That should be on a t-shirt. It probably is.
I think it is.
Oh, I love that. So how can our listeners and viewers, how can they support the center and the clinic and what you're doing?
Well, if you need the support, please come hit us up. But basically, I mean, there's all types of, funding opportunities. And like I said, we've historically operated on a sliding scale. The clinic, the most important thing has always been access. And so financially, we're not booming by any means. So financially, we always need help. But just get involved. Just pick a group, any group at the center. Because what we really are about, our community, is community and belonging.
Right. And that is so important right now, especially now.
Yes.
Is there anything I have not asked you that you would like to share with our listeners and viewers?
Well, for the clinic, like I said, it's always been sliding scale, which just makes access affordable. But we've also recently started taking IEHP and Aetna.
Okay.
And we are, in October, we'll be on board with Blue Shield. So more and more, we're trying to just make it even more accessible for everybody, to not have to pay out of their pocket.
Right.
Yeah.
Yeah. Thank you so much for being here.
Yeah, thanks, Will.
Oh, and thank
Yeah,
you
my
for
pleasure.
Thank you for the great work you're doing at the center.
Thanks.
It's
It's a privilege.
If you want to learn more about what Dr. Hingston is going to be speaking about at our summit, please visit our website, healthydeserthealthyu.com. Thank you.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydeserthealthyu.com. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music. Thanks for listening. Be sure to subscribe.